Beta-adrenoceptor blockers, or beta blockers, are a class of drugs that block the effects of the hormone epinephrine, also known as adrenaline, on the heart and blood vessels. They are used to treat various conditions such as high blood pressure, angina, heart failure, arrhythmia, and heart attack. Beta blockers are not contraindicated in patients with angina. In fact, they are often used to treat angina, which is chest pain caused by reduced blood flow to the heart. By slowing the heart rate and reducing the force of contraction, beta blockers lower the oxygen demand of the heart and prevent or reduce the frequency of angina attacks. Beta blockers are contraindicated in patients with bronchial asthma, which is a chronic inflammatory condition of the airways that causes wheezing, coughing, and shortness of breath. Beta blockers can worsen asthma symptoms by blocking the beta receptors in the lungs, which are responsible for relaxing the bronchial muscles and opening the airways. Some beta blockers are more selective for the heart and have less effect on the lungs, but they still carry a risk of causing bronchospasm in asthmatic patients. Beta blockers are known to cause bradycardia, which is a slow heart rate. This is because beta blockers reduce the effects of adrenaline on the heart, which normally increases the heart rate. Bradycardia can cause symptoms such as fatigue, dizziness, fainting, and chest pain. In some cases, bradycardia can be serious and require medical attention. However, not all patients who take beta blockers develop bradycardia, and some may benefit from a lower heart rate. Beta blockers are not known to precipitate heart failure, which is a condition where the heart cannot pump enough blood to meet the body's needs. On the contrary, beta blockers are often prescribed to patients with heart failure, as they can improve the heart function and reduce the risk of death and hospitalization. However, beta blockers should be started at a low dose and increased gradually, as they can cause a temporary worsening of heart failure symptoms in some patients. Beta blockers should also not be stopped abruptly, as this can increase the risk of a heart attack or sudden cardiac death.